Airline and cruise industries in crisis mode.
It certainly is a necessary step. Again, we want to review. I know we're all becomes
financial health on the line, and of course, what we were just talking about.
This is in purely personal capacity that I say this now, and it's not in reference to any one particular country over here. But who cares what the financial markets think? You're in a national emergency, you're in a global emergency. You shouldn't be worrying about how the markets are performing or what traders you're appeasing over here. You should be completely zeroed in on the discipline on tackling this health crisis over here. This health crisis, if you don't handle it, is going to get even larger and even deeper. And to be quite frank, in all of these countries, we don't really know how many infections there are. We don't really know how many people are confirmed cases or numbers of people dying from COVID-19. We need to know in this endemic flu season who's actually infected with COVID-19, who's actually infected with the flu.
James, there have been some very positive reports about the efforts that have been made in places like Singapore to combat the spread of this virus. They seem to be prepared for it, according to some of the reports. What are the measures that they took?
I think what they did well was that they were very, very good at testing. You look at South Korea, they're on it. I mean, they're doing about 10,000 tests a day. I think also what they've been very good is at mobilizing community leaders, although we can do a lot more of that. And I think in China, I mean, some people call it draconian, and I can certainly understand why they would say that, meaning severe and excessively harsh. But we live in these very excessively harsh circumstances over here in locking down cities, which we've now seen copied in Norway, in Italy. I wonder whether that's going to become a template for future outbreaks in responding to over there. But can I just add over here, the president has surrounded himself with very, very good people like Tony Fauci and Debbie Birx. Debbie Birx made that very strong link between the early years of the HIV/AIDS crisis, which the United States, of course, to this day has helped turn around on a global scale. And economically as well, paid sick leaves. I was talking to a friend in the UK yesterday who works as an electrician. He says that he's taking time off now because his young son is displaying flu-like symptoms. There isn't any suggestion that he has COVID. But if he doesn't work, he doesn't get paid because he's not on a salary, he's on a wage. So I think what's really important and where we can go even better than what we've seen in Asia is ensuring that there's a people-centered approach and that there's a human rights approach to all of this. But I think what Asia did very well is that they were very, very strict and very tough, and that they encouraged social discipline amongst their own people, and they were very, very unbending on that.
The China Current continues its special coverage on the coronavirus outbreak. Go to our social media at The China Current and our website for interviews, videos, and podcasts. I'm James Chau. Thank you.